Flu season is in full swing, and it is a nasty one. An unpredictable strain of it is striking just as other viruses hit our province.
Yeah, and it comes as walk-in clinics. They're locking their doors well before closing time. CTV's Penny Daflos explains what's going on.
We're facing a 1-2 punch this flu season.
We're seeing lots of influenza viruses circulating, as well as other respiratory viruses.
The dominant influenza strain this year is H3N2, highly volatile and particularly tough on seniors.
If anyone is experiencing any severe breathing difficulties, shortness of breath, or they're experiencing fever that's lasted a few days, we would also encourage them to seek medical care.
The problem is plenty of clinics are closing early.
Most often the clinic will have to close after the 50th patient because they cannot afford to stay open and only get paid 50%.
MSP pays doctors full freight for 50 patients a day, but after 65 visits, they won't pay a dime.
You know, it's understandable the government wants to control financial expenses, but in particularly bad parts of the year, like the flu season, there should be more flexibility. And I think that the government can make some changes in this area.
In an email statement, the Ministry of Health tells CTV News, "We have no plans to change this policy, which was designed to encourage doctors to have the time they need with patients to make a correct diagnosis." But that's not sitting well with patients like Nicole, who left the first clinic she tried.
The waiting room was packed. There was probably at least 15, 16, 17 people. So I knew right away it was going to be at least an hour or two, but when she said 3 hours and then she couldn't even guarantee I would get in.
She got in on her second try, but patients who find locked doors at clinics then have to go to hospital instead, taking up valuable emergency resources. Penny Daflos, CTV News, Vancouver.